Plastic in plastic surgery comes from the Greek word plastikos, which means to mold or to give form. And that is indeed what plastic surgeons do. The first documented accounts of plastic surgery go back as far as 800 BC to ancient India. During this period, the punishment in the Indian penal system for adultery was nose amputation. As you can imagine, surgeons of that time had many opportunities to repair these devastating injuries. They were actually the very first plastic surgeons of record. Medical historians generally consider the modern specialty of plastic surgery to have emerged during the First World War. The very nature of trench warfare during this time dictated that a soldier's lower body and torso were safely shielded by the earth around him, leaving only the head and the neck vulnerable to enemy fire. Such a style of fighting led to a massive number of facial disfigurements which were impossible to hide. These men in combat units who managed to survive these massive facial wounds, skull wounds, jaw fractures, and third-degree facial burns found that their troubles were only beginning. When they eventually returned home, these soldiers found it essentially impossible to acquire a job, find a wife, or even walk down the street without receiving glances of shock and disgust. The pioneers of plastic surgery realized that something needed to be done. During the war, the British, French, and Germans began to set up unique and specialized hospitals just to treat these severely injured and disfigured soldiers. When the US officially joined the war in 1917, several specialized new sections were set up within the general surgery department just to treat and better manage these unique war injuries. These groundbreaking advancements began modern plastic surgery. World War II brought even further refinements in the field of reconstructive plastic surgery and eventually sowed the seeds of cosmetic plastic surgery. A famous surgeon of the time recognized the great cosmetic potential of plastic surgery and was quoted as saying, and I quote, "If soldiers whose faces have been torn away by bursting shells on the battlefield could come back into an almost normal life with new faces created by the wizardry of the new science of plastic surgery, why couldn't women whose faces had been ravaged by nothing more explosive than the hand of the years find again the firm, clear contours of youth?"